Kawasaki disease, or mucocutaneous lymph node syndrome, is an illness that causes inflammation in arteries, veins, and capillaries. It also affects your lymph nodes and causes symptoms in your nose, mouth, and throat. It's the most common cause of heart disease in children. According to the Kawasaki Disease Foundation, around 80% of patients are under the age of 5 years. Less commonly, it affects older children and teenagers. In the United States, 19 children in every 100,000 are admitted to the hospital with Kawasaki disease every year. Kawasaki disease has 3 distinct phases, and its symptoms usually show up in one of the first 2 phases. The illness usually appears and subsides over the course of about 6 weeks. Phase 1 symptoms include high fever, fever that lasts for more than 4 days, swollen lymph nodes in the neck and possibly other places, rashes, particularly on the torso and genital area, red, dry, cracked lips, red, swollen tongue with red spots, this is called strawberry tongue, red, swollen palms of the hands and soles of the feet, pink eye without weepiness, irritability. In Phase 2, the following symptoms may develop: peeling of the skin on the hands and feet, joint pain, diarrhea, vomiting, stomach pain. The third phase is known as the convalescent phase. It lasts a few weeks, or sometimes months. In this phase, the symptoms resolve. There is no specific test for Kawasaki disease. A pediatrician will take into account the child's symptoms and rule out illnesses with similar symptoms, such as scarlet fever, a bacterial infection that causes fever, chills, and sore throat; juvenile rheumatoid arthritis, a chronic disease that causes joint pain and inflammation; measles; toxic shock syndrome; idiopathic juvenile arthritis; juvenile mercury poisoning; medical reaction; Rocky Mountain spotted fever, a tick-borne illness. In order to confirm the presence of Kawasaki disease, your pediatrician may order the following tests: Electrocardiogram. This test gathers information about the heart, such as damage and abnormal rhythms, by monitoring its electrical activity. Echocardiogram. This test uses sound waves to produce a detailed picture of the heart. It's best for assessing the pump function and valves of the heart. Complete blood count. This test examines blood cells to see if there are elevated numbers of white blood cells and platelets, which signal infection or inflammation and can point to the possible presence of Kawasaki disease. Erythrocyte sedimentation rate. This test can confirm the severity of the inflammation by the speed at which red blood cells fall to the bottom of a test tube. Because inflammation makes blood proteins heavier and can give them a tendency to clump together, if cells fall quickly to the bottom of a test tube, that's an indication of inflammation. Children diagnosed with Kawasaki disease should begin treatment immediately to prevent heart damage. The illness is usually treated in a hospital, because of the risk of complications. Your physician might prescribe medication to make them feel better, such as aspirin and drugs that prevent blood clots. Don't give your child any medication without talking to your doctor first. The physician will probably also give them immune globulin into a vein, intravenous, or IV. This has proteins called antibodies to help fight infection. It's more effective when a child takes it with aspirin than aspirin is alone. It will lower a child's risk of heart issues when they get it early on in treatment. Kawasaki disease leads to serious heart problems in about 25% of the children who have the disease. Untreated Kawasaki disease can lead to increase your risk for a heart attack and cause coronary artery aneurysms, irregular heart rhythms, heart valve problems, blood clots,